Hello, everybody, and welcome to the ALS United Mid-Atlantic Goals podcast. My name is Tony Heil with ALS United Mid-Atlantic, and if you've listened to this podcast before or watched on YouTube, you know that we have spoken with many people from a variety of perspectives on ALS, from people living with ALS, caregivers, advocates, nurses, and other caregivers, and those who are working in research as well. Today, I'm excited to talk to my friend Paul Melmeyer from the MDA. He is an executive vice president on public policy and advocacy, and we have been working together on a variety of different advocacy needs, from Act for ALS to protecting Medicaid and making sure that patients can receive the care they need and they can access research, clinical trials, and be part of the cure for diseases like ALS. Paul has extensive experience for over a decade, over 15 years working in these fields, and he can talk about the details of public policy and how you can be an effective advocate and how we can continue to collaborate to make the world better for people living with ALS and other diseases as well. So, Paul, thank you so much for speaking today.
Yeah, thank you for having me, Tony.
So, before we get too much into the conversation about the details of legislation, tell me a little bit about your background and what brought you to MDA.
Absolutely. Well, thank you again for hosting me and the Muscular Dystrophy Association today on the podcast. It's really a pleasure to be here. I started my journey in advocating for those with ALS actually almost 15 years ago at this point. It was in the early 2010s that I started at the National Organization for Rare Disorders, working for all 30 million Americans with a rare disease, and that includes those with ALS, of course. And it was about 6 years ago or so that I transitioned over to the Muscular Dystrophy Association, where, of course, I narrowed my focus in advocating for those with rare neuromuscular conditions, including those with ALS. So, over the course of that time, I've learned a lot about the public policy that affects those with rare diseases and rare neuromuscular conditions such as ALS, and have been it's been quite the privilege to be advocating for those with ALS.
And I'm really happy that we've been able to collaborate, especially over the last year. ALS United and ALS United Mid-Atlantic have been working to collaborate with a lot of different partners to work on research initiatives, to work on advocacy, working with groups like ALS TDI and IMALS, because united, we're going to get more done. So tell us a little bit about some of the recent advocacy wins that we've been able to work on together. Not you and me particularly, but the ALS community, because you know a few things like the protecting Social Security disability insurance access and things of that nature.
Absolutely. So it's been quite the productive years, 5 years, I'll say, at a minimum for those with ALS when it comes to making progress on public policy. And none of the things that I'll mention here are unique to any one of the organizations that advocate for those with ALS, whether it be us or some of the organizations that you named there, Tony. Every one of these efforts that has been successful has really been a community-wide effort. You mentioned a couple already. It was just a handful of years ago when we were successful in eliminating the waiting period for SSDI and Medicare for those with ALS, a waiting period that still exists for everybody else that qualifies for SSDI and Medicare. Now, those with ALS no longer have to wait those months to finally access the benefits in those programs that previously they had to wait. Additionally, it was in December of 2021 when the Act for ALS was signed into law. It was President Biden in the White House who congratulated the ALS community and the organizations and many individuals who had worked so hard to get the Act for ALS across the finish line. And within that legislation, of course, there are a number of different provisions that are seeking to accelerate therapeutic development for those with ALS, as well as access to some of the promising investigational therapies that are still working their way through clinical trials. Most recently, I have to give a shout out to just last year when the FAA reauthorization was signed into law, in which there were actually a number of provisions that make air travel more accessible for those with disabilities and those who are wheelchair users more broadly. And I know the ALS community played a incredibly important role in actually getting that legislation across the finish line and ensuring that that legislation, as well as the legislation on Medicare and SSDI, as well as the Act for ALS, were all bipartisan and were passing, if not unanimously, but nearly unanimously. You had Republicans and Democrats equally espousing these bills, trying to ensure that they were to be enacted. So that's all just within the last handful of years. Public policy can really move at a glacier's pace at times, and just look at the progress that we've been able to achieve together in just these handful of years.
Yeah, I know from my experience in advocacy that things can move really slow and then really fast all at once. And with Act for ALS, I remember it we tried to get it passed before, and there was a little bit of opposition, just very tiny opposition. But that's kind of how the process can be gummed up, as they say, with one person can block things, and then the next year, I think the Senate vote was like 99-1 or something along those lines. So huge bipartisan support. And I appreciated when the President Biden at the time signed it. He recognized people like the Mackler family from Delaware, who've been very involved with ALS United Mid-Atlantic for 30 years because of Scott Mackler, who had ALS. Those personal relationships make a big difference in advocacy. I'm sure you've seen that in your time with MDA and NORD about how personal relationships between an elected official, whether it's the president or a member of Congress, can really help drive home legislation to help people with ALS.
Yeah, frankly, those personal relationships make all the difference when it comes to successful advocacy and public policy initiatives, and those that are still they're still working on, because it's those personal relationships that constituents can develop with their lawmakers that really can bring the effects of the policy that are being considered, bring them off the page, bring them out of that 300-page bill that is conceptual, that is rooted in wonky policy and law. But when you actually meet somebody with ALS, or you actually talk with someone with a rare neuromuscular condition and understand why access to certain care, or the acceleration of therapeutic developments, or breaking down barriers in front of those with a disability, including, of course, those with ALS, how those impacts really do affect the lives of our community. There are several examples to cite. You already cited the Macklers, of course, but I think about the FAA reauthorization we had just mentioned. Mindy Henderson is a member of the spinal muscular atrophy community. She's also an employee of MDA, but accessible air travel has been a passion of hers. And when she came to Washington, D.C. to talk to her Texas legislators, she was able to talk with Senator Ted Cruz's staff about the indignities and the injurious, oftentimes, experience of air travel as a wheelchair user. How on her way to Washington to talk with the individuals in Senator Cruz's office, she was nearly dropped in her seat transfer and her ankle was twisted, and how it was incredibly embarrassing and an undignified experience. And through that conversation she was able to have with that staff member became passionate about the issue, and consequently, I think, at least in part because of that conversation that he was able to have with Mindy, some of the most transformative legislation to actually ensure that those who conduct seat transfers for those who are traveling by air with a disability, that legislation included robust provisions that required training and education for those, so that no more individuals would have to be injured in that seat transfer. And it was actually Senator Ted Cruz himself who was ensuring that that was going to be in the final legislation. That's just one example. There are many examples we can cite of individuals with ALS or individuals with other neuromuscular conditions who have gotten to know their legislator, who have made sure that that legislator is almost as passionate as they are about the issue, and that's how ideas become laws.
And we know that many senators also are impacted by these issues. They are impacted by disabilities and accessibility. We were just in Washington, D.C. a few weeks ago, and I ended up in the Capitol, and I saw Senator Jim Justice and Senator Tammy Duckworth, both of them using assistive devices to get into the Capitol. And I'm very happy that they have those devices. That's bipartisan. So we're not talking about things where there's someone else in their district or state that needs this. This is often the senators and members of Congress themselves and their families who are also impacted by the advocacy that we're trying to provide.
100%. And you name several good examples of senators who live with disabilities themselves and consequently have the personal experience that then drive their own work within the Senate. Senator Duckworth has been the longtime, if perhaps biggest champion of accessible air travel, and she frequently talks about how many times her wheelchairs have been damaged or even destroyed
Mhm.
when traveling by air. And she does travel by air a lot, obviously, to make it to Washington, D.C. from Illinois as frequently as she does. I also think about Senator Lisa Murkowski up in Alaska, whose cousin, her husband, passed away from ALS. And there's an annual convening of advocates in the ALS community called No More More Than Our Stories, I should say, that happens each February. And Senator Murkowski comes and greets ALS advocates as part of that convening. And it was just this past February where she talked extensively about the experience that her cousin Lisa, I'm sorry, not her, that she's Lisa, that her cousin has gone through in navigating ALS, that her whole family in Alaska went through in navigating ALS, and how that drives her in her work in the Senate. So many personal experiences that, whether they be ALS specific or not, that our senators and representatives have that they bring to Washington, that then we hope to work with them to channel those experiences that they have had into the impactful legislation that would benefit everybody within the community.
I'm going to get into the legislation in a minute, but that does touch on how you can be an effective advocate, whether you're someone like us who is working full time on this or you're someone who it's your first time advocating, is to do that research, not necessarily into the legislation, but into the person you're meeting with. Like ALS is a service connected disease, so if you know that the member of Congress you're meeting with is a veteran or cares about those issues, it's good to bring that up. Maybe something about football or the sports they play because there's a connection there. Understanding the people you're going to meet is going to help you make that very personal connection that can last a long time, right?
100%. And there are so many ways to do it. You named some great examples there of whether an individual is a veteran, and so they have connections to the veteran community, and we know there is a higher prevalence of ALS within those who are veterans, those who have served. Same goes for if there's a connection to the firefighter community. Those who are firefighters may also have a higher prevalence of living with ALS after having been a firefighter. It could be even simple things such as they went to the same school as the clinic that our community may be going to. Perhaps they graduated from Columbia. And we all know there's a prestigious clinic at Columbia or at any number of ALS clinics that might be affiliated with the university that the senator or representative had gone to. Or perhaps they have a cousin that lives in the same small town. There's all ways in which, so many ways in which one can make a personal connection that really ties the lives and experiences of an elected representative or senator to the life or experience of someone who's living with ALS. I would venture to say nearly everybody can make that tie. It's almost that 6 degrees of separation type of test where you can find that common experience or common interest that a representative or senator may have with you, with whomever is up there advocating to that representative or senator. And that really opens the door. That allows for that personal connection to start forming. And even if they themselves don't have that experience with ALS, if they know that they have a common experience of where they're from or where they went to school or who they happen to grow up with or whatever it happens to be, then that means you're starting on common ground.
Mhm.
And you can start developing that relationship that is centered around ALS from there.
Yeah, recently I was doing some state advocacy with my friend Steve Cronin, who has ALS, and he was a firefighter and one of the local state senators from Bucks County. He is a firefighter as well, and they had a great relationship. The staff person was excited to meet, then the senator was excited to meet, and that I think it's going to make a big bond for some really great things we can do in Pennsylvania. So one of the great things we have done, like you mentioned, is pass Act for ALS. And let's get into what that means because it stands for Accelerating Critical Therapies and Treatments for ALS. We want to get cures and treatments faster because this disease is so rapid, and we want people who have ALS to get the treatments they need as quickly as possible. So, what goes into Act for ALS? What should the ALS community know about it?
Yeah, that's a great question, and it's still one of the most important pieces of legislation that has been passed for those with ALS, and it continues to have incredibly important impacts on the future of living with ALS. Really, there are four main things within the Act for ALS to know. The first is that there is a provision that would create an expanded access grants program for those with ALS to be able to access at no cost, at least should be at no cost, investigational therapies that are working their way through clinical trials to be able to access those therapies outside of the clinical trial. We know that many folks with ALS unfortunately don't qualify for most, if not all, clinical trials because of the progression of their disease. They're either too far progressed or not progressed far enough for the inclusion criteria of that specific clinical trial. Or there could be other reasons for why an individual may not be able to qualify for the clinical trial. And thus, expanded access is one of the only possible options for slowing the progression of ALS outside of the therapies that are available on market. And we all know, of course, there are very few therapies available on market to try to slow the progression. So this provision was trying to increase the availability of expanded access programs, and sure enough, over a handful of years in which Act for ALS has now been implemented and has been law, there have been millions of dollars that have been allocated from the NIH to companies that are in those investigational research stages in clinical trials to then allocate their therapy to individuals via expanded access programs. And so that's a very important piece of the legislation for many in the ALS community. It is the most important piece of the legislation. But we shouldn't forget the other three parts that are important to mention, including the public-private partnership that's been set up between organizations such as MDA and ALS United Mid-Atlantic and the other ALS organizations, as well as the clinicians and researchers in the field, with the federal government, with the Food and Drug Administration, with the National Institutes of Health. And this public-private partnership is an opportunity for us all to get together and talk about what we should be prioritizing as a stakeholder community working with the federal government to try to accelerate therapeutic development for not only ALS, but also rare neurodegenerative diseases more broadly. And this partnership has led to projects that focus on biomarker developments and surrogate endpoint developments so that we can unlock new pathways at the Food and Drug Administration for approving therapies for ALS. This partnership has also led to focuses on clinical outcome assessments, how we measure ALS, so that clinical trials can be reformed going forward to measure ALS in a way that's more impactful for those with ALS rather than some of the historical ways that don't perhaps translate particularly well to the lived experience of those with ALS. The law also includes a grants program that actually funds this kind of work, upwards of $5 to $7 million per year, that the FDA is funding projects to translate ALS FRS from the clinic setting to the remote setting, the virtual setting, so folks can actually participate in clinical trials from home. And there's also projects that they funded in myotonic dystrophy and ataxia telangiectasia and some of the other rare neurodegenerative diseases that qualify for the program. And then finally, the last thing to mention that the Act for ALS Commission was a regulatory action plan from the FDA
Mhm.
that actually set the course for FDA's priorities for what they were going to be doing to try to evolve and innovate in their practices in ALS and other rare neurodegenerative diseases. And it was that plan that was published, I believe, in the summer of 2023 that outlined the full extent of everything that the FDA wanted to try to accomplish over the ensuing 5 years or so in innovating their approach to ALS. So all of this is still in present tense. We're still within the first 5 years in which the Act for ALS has been in existence. These are all efforts that are continuing today. Work within the public-private partnership, new grants that are being distributed by the NIH or the FDA, or ways in which the FDA is implementing the regulatory action plan. So we continue to see the fruits of Act for ALS coming to bear, and we look forward to continuing to see that going forward.
And I think one of the things that is so exciting about this approach is that now we understand different ways of measuring ALS progression and if a drug or therapy is working for it, like you said there. And Act for ALS can help along that line. I spoke with Carol Hamilton from ALS TDI about this multiple times, about that, we have this old way of understanding the progression of ALS, and maybe it's outdated, and we can look at things about how you walk, how you speak, how your handwriting, various ways that now maybe the FDA and others can look at it and say, no, this therapy is working, but we couldn't see that because we were looking in a different light.
Yeah, absolutely. And in addition to being able to be more precise with the measurements in certain areas and perhaps employing wearables, wearing technologies in which individuals can more precisely track the progression of their ALS and thus more precisely track the effectiveness of a prospective therapy. Also, these measures are more meaningful to those with ALS. They're not going to be something that is thought to be meaningful by a clinician or thought to be meaningful by the FDA, but in reality, that specific way in which this drug is going to work doesn't actually matter as much to someone with ALS as perhaps some other measure. That by developing these patient-focused clinical outcomes, clinical trials themselves will be more patient-friendly, will be better at measuring what's important to the ALS community, and then the resulting therapy that hopefully will then be approved will be more effective and more meaningful to those with ALS.
And I've spoken with many people with ALS who have participated in expanded access and some clinicians who've talked about it. The way it works through Act for ALS and in general is not just that, oh, we heard that this thing might work and you should try something off market. It's really through a safe way of doing it where you're talking with a doctor and a researcher, and you can get kind of the guidance you need that, okay, Doug, you have ALS, this may work for you, or Steve, this may work for you. And it's a guided process, not just throwing yourself into the deep end.
100%. Yeah, expanded access it's extensive in the sense that there are many individuals or entities at the table in deciding whether a therapy should be approved and available via expanded access. In the case of this program in particular, at the NIH Expanded Access Grants Program, of course, the NIH is involved in the choosing of the therapies that will be available via expanded access, but the FDA is also involved. The FDA signs off in that from what they know of the therapy at that time, that the benefits of giving this therapy in an investigational sense to someone with ALS outweigh the potential risks for those with ALS. The clinician is involved, obviously the individual with ALS and their community is involved, and an IRB is also involved because these are research protocols. That's the other thing that's important to mention. Under the Act for ALS, it was required that the provision of these therapies via expanded access wasn't only just going to benefit the individual receiving the therapy, that also there would be data collected through the course of prescribing this investigational therapy in the expanded access setting, and that data could still inform the Food and Drug Administration, could inform the company, could inform really the entire enterprise, frankly, of how this therapy appears to be working within the expanded access context, and that's additional data then that the FDA, the company, even patients for that matter, can then later consider as the therapy could later be approved for access for those with ALS more broadly. So there's a number of ways in which this is an extensive process, but it's streamlined. FDA has been doing this for decades. It actually happens fairly quickly. It sounds like it's a lot of steps, but really can happen within the course of 24 to 48 hours in an emergency context. And within the case of ALS, doesn't have to happen much longer than that, frankly. And so the safeguards are there, the evidence is there, and so it has the right balance of, yes, this isn't approved yet, but the right balance of ensuring that the benefits are going to be able to outweigh the risks, that is there.
And that's why the FDA is not a bad guy in this situation. It's also important that they are properly staffed and adequately staffed to handle all these requests. But I very much sympathize with those who are impacted by ALS that are frustrated that the FDA doesn't approve things faster because I know people with ALS, I want them to have treatments as fast as possible. But doctors like having the FDA process because it gives them the faith that they're prescribing something good. And even drug companies want the FDA process because it validates their therapies that they putting into place. So they're looking for the FDA label. They're looking for the FDA to validate their work so that other people will take it. Otherwise, there's less trust in the medical system.
Yeah, that's right. It's only the FDA that is equipped to ascertain the incredibly complex adjudication of whether a therapy's benefits outweigh the risks, because there's this thought among some that the products are some products are purely safe, and that if it's safe, then from there it should be attainable to whether it be an individual with ALS or even more broadly than that, it could be whomever. That if a therapy is safe, that the effectiveness should be up to the individual on whether they want to then try that therapy, so long as the therapy is safe. But nothing in really just in general, any kind of product that we put into any of our bodies for that matter is purely or truly safe. There's always that chance for a side effect. Tylenol has side effects. Over-the-counter therapies have side effects to some, if not many for that matter. And so consequently, it's always a calculation that only the FDA is equipped to make of do the full suite of benefits of this therapy outweigh the full suite of risks of this therapy. And that calculation is being tested throughout the clinical testing of that product. Yes, safety is primarily tested within the course of phase 1, phase 2 of clinical trials, but it's incredibly important to still have safety in mind in phase 3 when thinking about, well, the effectiveness or the efficacy that we're testing in a phase 3 clinical trial for a product still needs to be weighed against the safety profile that is also still being tested within that phase 3 clinical trial. And all of that is balanced and is considered by the Food and Drug Administration as it's considering whether this product is safe, whether it's effective, and whether the benefits outweigh the risks. So it's that FDA process that's in place that can then give any community that is going to be seeking an FDA-approved therapy or therapy in general the confidence that the benefits of taking that therapy is going to outweigh the potential risk, and that that therapy is going to be manufactured in a safe and consistent way, that that therapy is going to have the shelf life that it needs in order for it to then be administered in a safe and effective way, that the administration of perhaps using an IV rather than a pill or subcutaneous, that that's going to be the most advantageous way to administer. These are all the calculations FDA goes through. That again, only the agency is equipped to actually make those very complex decisions and then recommend whether or a therapy can be taken from a community's perspective.
One of those big risks is cost, not just for the drug developer, but for someone taking it. It's a major risk to take a drug if it's going to cost your life savings. And it's not fair to tell someone, oh, Bill, you are taking this drug and it's going to cost you $100,000 a year unless you have the best insurance and you take it and it doesn't work for you. That's very unfair. So you want to be able to have the trust from a doctor perspective if you're prescribing something that you're not telling someone take this drug and give up your house and your savings and the fun for your kids. That no, this is worth your time and money to get.
Yeah, 100%. And that's another important, very critical aspect of an FDA approval. And not only then is that important for the individual in question, as they are considering, do I want to spend this much money on this prospective therapy? Because I need to decide whether the benefits of taking this therapy are going to be worth the cost. But that's oftentimes a calculation that the individual themselves may not be making, but their insurer, their health insurer is. For those with ALS, of course, most often it's Medicare, but broadly it could be Medicare, it could be Medicaid, it could be a private insurer, and it is they who are looking at the FDA approval to then decide, well, am I going to actually cover this therapy, this intervention within my health insurance plan so that all the beneficiaries within the health insurance plan don't have to pay out of pocket? Of course, it's a benefit that they have for being insured by the health insurer that they will be able to obtain the therapy at a relatively minimal copay or co-insurance, or after having met their deductible, or whatever it happens to be within the health insurance plan in question. So an FDA approval is critical for a health insurer to decide whether they're going to cover a therapy. And that's why if we're talking about potentially, in some cases, weakening the FDA approval process or relying on FDA's safety assessment, but not necessarily requiring as much of an effectiveness assessment from the FDA, what we would see is that health insurers will be much less likely to actually cover that therapy. And consequently, whether it be the ALS community or any other community, may be forced to pay out of pocket or not be able to obtain the therapy at all. So it's another reason for why that FDA process is so critical, is it informs the health insurance industry on what they should be covering so that our community can then access that therapy in an accessible and affordable way through their health insurance thereafter.
One of the things you brought up that we do need to talk about on this podcast is Medicare and Medicaid. We are really concerned about protecting Medicaid and what it provides for our families. Many people with ALS need Medicaid for their long-term care or what they need in their home. Uh, and especially with how fast ALS progresses, they need to be able to get those funds as quickly as possible. So, can you please let me know from your perspective at MDA, what people should know about what's going on with Medicaid advocacy right now?
Yeah, so Medicaid has been one of our greatest focuses at the Muscular Dystrophy Association over the last several months. And the reason for this is because on Capitol Hill, and I can say literally as we speak on Capitol Hill, there are some really important conversations on the future of the Medicaid program. This is because there are congressional Republicans primarily who are looking to extend tax cuts or tax policy that was passed in 2017 that expires at the end of this year. They are seeking to extend those tax cuts or those tax rates beyond 2025 into years thereafter. But to do so, they want to be able to offset the cost of doing so by paying by cutting expenses elsewhere. And actually, primarily where they're looking to cut expenses is cutting the federal government's contribution to the Medicaid program. To your point, those with ALS are primarily covered by Medicare. However, Medicaid is still very important to those with ALS because, as we know within Medicare, Medicare does not cover everything. As we also know with ALS, ALS is an incredibly expensive disease to live with. And so consequently, having Medicare and then maybe another private insurer, sometimes that can work, but oftentimes individuals with ALS turn to Medicare and then have Medicaid as their secondary insurer.
Mhm.
And because Medicare doesn't cover everything, and the most noteworthy example is that home health care that is so essential to living with ALS, allowing an individual with ALS to still be independent and not and live within their home rather than live within an institution, and oftentimes allowing individual with ALS's family member to still work, to still, live the life that they want to be leading without being a full-time caregiver if they choose not to be a full-time caregiver. It's that paid home health care that Medicaid pays for that is so important to those with ALS. And some of the things that are being discussed on Capitol Hill right now would jeopardize that very care for those with ALS. There are three things that are being discussed on Capitol Hill that we like to highlight that are of a special concern for us, for those with ALS and for those with neuromuscular conditions more broadly. The package that's being discussed would raise costs for those with ALS or those with neuromuscular diseases more broadly because there's an additional cost sharing that will be required for people who qualify for Medicaid based upon income rather than disability. But that additional cost sharing that they need to then pay for up to $35 per service if they are covered by the Medicaid program in their state. Currently, that's not a thing. It's optional for certain states. A handful of states choose to do so. This would require that cost sharing in the Medicaid program. There are a handful of other provisions that would raise the out-of-pocket costs for those who benefit from Medicaid. This package that's being considered on Capitol Hill would also add a lot of red tape that those who benefit from Medicaid would have to navigate in continuously proving their eligibility for Medicaid. They'd have to prove that eligibility more frequently than they do today. They would have to prove their disability more frequently than they do today, because otherwise, if they're not proving their disability, they'd be subject to what are called community engagement requirements, in which they would need to work, volunteer, or go to school for 80 hours a month in order to maintain their Medicaid. And as we know from many with ALS, that's just not possible to do any of those three things for 80 hours a month. And there are a number of other ways in which administrative layers are being added to the Medicaid program through this package that would be very burdensome for those with ALS, that would be burdensome for everybody who benefit from the Medicaid program. The third thing I want to highlight, if I may, Tony, is that a lot of money is being pulled out of the Medicaid program and pulled away from the federal government that would then give it to states to be able to administer the Medicaid program at the state level, because Medicaid is actually largely a state-administered program, but it's co-funded by states and the federal government. This package would pull a lot of the money that the federal government gives to states to co-fund Medicaid, and consequently, going forward, there'd be a lot less money for state Medicaid programs to be able to pay for all of the necessary costs and services that Medicaid programs cover for. And so the first thing that oftentimes actually goes away in the case of state budgets being constricted, in which case they would be if this package is passed, are the voluntary, the optional services. And what we started with in this part of the conversation was home health care. Home health care is not a mandatory service under Medicaid. Home health care is voluntary under Medicaid. States voluntarily choose to offer home health care to those with ALS, those more broadly. Uh, but if they have this much less money to work with because this package takes that federal government money away from them, then they're going to be dropping home health care services. And that's going to be very bad for those with ALS. They're bad for many folks. So it was for these reasons, these three main reasons, why we are in opposition to this package. We're hoping that Congress is going to choose not to pass this package, and that we're rallying the community to be contacting their congresspersons in opposition.
I was just talking with someone from another advocacy group that was not involved with ALS, and he said, "Oh, well, I saw that they're just doing these things on work requirements, as they say, because there's a lot of political language that gets out in the community that regular people will say, oh, that sounds fine, but those regulatory burdens, those paperwork issues, they end up dropping people from the Medicaid rolls. And if anyone's filled out just a regular tax form or a FAFSA form for college, it feels really easy to miss something, like just miss, like, oh, I forgot my mother's maiden name, or I forgot that I had this on my resume. It's not like it's a problem with you. It's just a normal thing to miss some paperwork. I have to get my car inspected next week, and the month might get by me, and I may not remember to get it done on time. And even just needing, like you said, 80 hours a month, if you have part-time work, that you may think you have 80 hours and then it goes away. So these are a lot of extra stresses on a person with ALS or with other diseases or even their caregiver that they don't have the time to take care of.
Yeah, I am glad you brought up the caregiver in this calculation, because it is oftentimes they who are actually most worried about, because
Mhm.
to be a familial caregiver is, as we know, it takes up most of one's time to take care of or be the sole caretaker of an individual with ALS, especially an individual who has progressed further. And so they are not going to be able to be working 80 hours a month. These familial caregivers, they're not volunteering, they're not seeking education at the same time. They're doing everything they can to support their family member. And it is they who are worried about uh, being caught up in being expected to work or school or volunteer 80 hours a month. And if they do not, because they're taking care of their spouse or their family member or whoever happens to be, that they're going to lose access to Medicaid. They're going to lose their health insurance. And so their health is going to be compromised by this package. But to your point, this has already been tested in Arkansas and in Georgia over the course of the last 5 years, two states that have instituted work requirements. And we've seen in both states how, for one, these work requirements haven't led to increased employment. They haven't led to more people seeking work because they need to work in order to gain Medicaid. That's been shown in Georgia. And what we saw in Arkansas is that there were tens of thousands of people who lost access to Medicaid for procedural reasons, not because they didn't qualify, not because they didn't meet the work requirement bar that Arkansas had set for them, but because the paperwork wasn't correct, that they missed a deadline, they filled out the wrong maiden name, they checked the wrong box, the mail went to the wrong address, the got lost in the mail, whatever it happened to be, that they lost access to their health care, and they lost it for a long time. They didn't quickly get it back for procedural reasons. And this is why we're so oppositional to these work requirements, not because we don't believe people should be working. Yeah, people should work if they can work, but it's because what we've seen that these are paperwork requirements. These aren't work requirements. These are procedural ways in which people are kicked off the rolls that should have access to their health care. And we believe those with ALS and across the rare neuromuscular disease community, they will be caught up in that.
And my sympathies to anyone with any sort of these diseases that MDA covers. But we know with ALS, people live on average 3 to 5 years from diagnosis, and many of them sadly live longer than less than 3 years, fewer than 3 years. And so that means that when you're having these delays of getting the care you need by months, that means that instead of having a year with your loved one in your home that is fine, that you're getting the care you need, that's bringing it down to 6 months or less. And also, we know that long-term care costs for a person with ALS can be over $1.4 million in Pennsylvania for the kind of care you would need in a long-term care facility. Home care is so much more affordable. because you don't need round the clock care all the time. You don't need to pay someone round the clock, and you don't need to have the insurance and the staffing and other ways that you need in a long term care facility, which can be great, but home care and home health aides are such a more affordable and safer option for so many people with ALS. And they may think they're not impacted by these Medicaid cuts, but as you said, just because states have to find the value, they have to find the savings, those services can be cut indiscriminately in order to make save money.
That's right. That's right. And that's the very situation that we're concerned about if this package is passed by Congress. We again hope that it's not. And if anybody who's watching or listening to us right now, if you haven't contacted your congressperson, we really encourage you to do so. To tell them if Medicaid's important to you, to tell them how home care is important to you. You can go to mda.org/Medicaid is where to find our homepage for all the resources that you need to read up further on what's being discussed on Capitol Hill if you want to look further into the details, but also where you can then follow prompts to contact your representative, to contact your two senators, to tell them that Medicaid is essential to healthcare for those with ALS, perhaps healthcare for you, and consequently you don't want them to be cutting it to the extent that they are discussing right now.
When we were in Washington, D.C., even though it wasn't one of our stated priorities because there was legislation for ALS, we did bring it up many times. And as I met with Senator Chris Coons with my friends Kristen and Craig, Craig has ALS, Kristen and his wife, and she's amazing. And I said, most people with any disease don't have someone like Kristen, who is a tireless advocate for Craig. And it doesn't mean that other caregivers aren't great, but she has just spent so many years fighting on his behalf, and it's hard to be that person. And not everyone has a spouse or a parent or a child who can be that advocate for them. Like, we need people to be able to step up where they can, and Senator Coons was very sympathetic to that. So I say that story because those stories are so impactful. If someone with ALS or another condition hears this, I can connect them with you and say, hey, if you're having that Medicaid meeting, we're working with the MDA. Here's somewhere where you can talk and you can make a big impact so it doubles the impact on the Medicaid discussion, right?
Yeah, absolutely. Yeah, yeah, for sure. I mean, our campaigns or our initiatives are for everybody who is benefiting from the Medicaid program or from the programs in general that are being discussed in this budget reconciliation package. So 100%, we encourage everybody to join us.
So, Paul, once more before we finish here, what is the best way that people can connect with you or go on their website to learn more about advocacy and how we can work together?
Absolutely. There are several ways I would encourage anyone who's listening or watching us today. I'll mention again mda.org/Medicaid for specifically our campaign around trying to save Medicaid from some of these very, very concerning cuts that are being considered on Capitol Hill. But we do a whole lot of additional work. We've already talked, of course, about Act for ALS, which needs to be reauthorized next year, as well as a number of other areas. The best way to just keep an eye on our advocacy more generally is to go to mda.org/advocacy. That's kind of our homepage for all of our public policy and advocacy work on access to care, but also therapeutic development and serving those with disabilities. I'd also say if you want to reach out to us, you can find us at advocacy@mdausa.org. That's our email address. Feel free to shoot us an email. We are always responding to the emails that we receive there, whether it be a question about any of the work that we do, asking if you can be connected to another service that MDA has, whatever it happens to be. Those are the three places I would encourage folks to check out or contact us at today.
I don't want to take up too much more time, but I know that a lot of these issues impact us personally on a mental health issue because it can be very stressful knowing about the impact that these cuts or these other legislation can have on our families. We care deeply about it. But on a lighter note, we're both baseball fans. I'm really excited about the Philadelphia Phillies. They've done so much to support the fight to strike out ALS since 1984. And I'm from Pittsburgh originally. I know you're a Pirates fan. So maybe at some point soon, if I'm in Pittsburgh, maybe we can see a Pirates game at one of the best stadiums in the country, right? And then maybe we can talk about these issues in a more peaceful and happy setting. I hope that would be good.
That sounds excellent. Maybe we could try to line it up with Paul Skeens, who is I think everybody's favorite starting pitcher these days. See one of his starts.
Before they trade
Maybe
him
get
away.
before they trade him away. Get one of these little bobbleheads if they happen to be giving them away that day. But yes, being a Pirates fan is a thankless endeavor for me over the decades in which I have. But you're right, it's a beautiful ballpark. count me in. I'll be there.
If anyone can stick with being a Pirates fan for decades, that shows a dedication that they have to anything, and that means that I know that Paul is dedicated to finding treatments and cures for ALS and to fighting for those with disabilities. Thank you so much, Paul. I'm really excited to collaborate and work with you for our ALS families, and I know we'll get a lot done together as champions for this cause.
Yeah, thank you, Tony. You've been a great partner. Looking forward to everything we'll do together.
And as always, if you're interested in joining our fight against ALS or learning about our programs and services and research, please visit alsmidatlantic.org. Follow us at ALS Mid-Atlantic and like and subscribe to this podcast on YouTube, Spotify, and iTunes. Leave your comments, and we'll love to have more guests that you recommend and more topics that you care about. Thank you, and let's continue to fight ALS together and collaborate for a cure.